It's great to have you here, Kalev. I know that I started to think about what was then called the novel coronavirus in mid-January. I picked up some news stories across the internet somewhere. But my sense must be that with all your work in the GDELT project, you were probably well ahead of the rest of us.
Yeah, it's actually a fascinating story. So in the aftermath of the 2014 Ebola epidemic, we went back and actually found that we had actually collected some of the earliest glimmers of that outbreak through local media. But one of the challenges at the time period, we weren't translating. We were only processing English language material. So fast forward, so over the years then, we've really focused then on mass machine translation. So essentially what we do, GDELT each day, is monitoring local media from across the planet, mass machine translating everything it acquires in 65 languages. And then it essentially generates sort of this public open data annotated feed of what's happening around the world. So fast forward to the present pandemic, and back in December, there's actually a biosurveillance startup in Canada called Blue Dot Global, and they actually monitor, they actually have their own machine learning models that they take our feeds, apply these models that go through that and actually look for what their models determine to be early glimmers of an outbreak. So in this particular case, in the end of December, their models picked up SARS-like viral pneumonia of unknown origin, and then they actually sent out actually an alert to their global customer base, I think December 31st. So it's kind of this perfect kind of story of, 6 years ago, we monitored those early glimmers, but we weren't able to see it because of the translation piece. We added that, and now, in this case, a company was able to send out that alert. So again, it reminds us that if we want to, be ahead of the news, if we want to understand what's happening in the world, we really have to look at local media and local languages, and we have that ability. Machine translation is far from perfect, but it's good enough.
I mean, it's an amazing story. It's amazing that just by scanning the web, you're able to pick up that early signal before many governments did. But there was something else that amazed me about that time, which was, of course, nobody really knew what this thing was on the 31st of December. And yet within a few weeks, we had the first academic papers. They were preprints. They weren't peer reviewed, that had been written, and they were put out on these preprint servers like bioRxiv and medRxiv. And after that, you saw, I mean, we're tired of the word exponential, but we saw this exponential growth of academic papers. We passed more than 2,000 papers about coronavirus and different aspects of it in March. And then by the end of May, more than 20,000 papers had been put out there. And what was fascinating for me was to see science play out in public. It was to see the levels of knowledge build over the course of those 6, 8, 10, 15 weeks, but also that it happened in a way that was accessible to anyone in the world, much in the same way that a blog post in China is available in the UK, or a newspaper in Santiago is available in the UK. It played out in a way that the average consumer could follow, and mass media in some sense was also helping them do that. I mean, how does that play into our understanding of what was going on with the pandemic?
This is one of the challenges, is that we've really lacked a communicator in chief in this pandemic. The public is really, one of the challenges, the public is seeing science play out in real time. And science is very messy, chaotic, conflicting. A study that comes out today might be disproved by a study that comes out tomorrow. And so one of the challenges is the public is seeing all this. The news media is vacuuming up all this and reporting this in real time. And of course, media, thrives on conflict. And so, the moment you can say, hey, there's a new study that contradicts the one from tomorrow, you get this. In turn, universities are pouring out press releases. As a journalist, I'm getting these press releases every day of universities saying, hey, we've come up with the ultimate solution, or we've come up with this, critical finding that contradicts everything else. And in turn, those same experts are taking to social media, playing out and battling it out. We lack someone that can cut through that and say, look, here's what we know. Here essentially is what you as a public should be worried about at this moment. Here in the US, it was don't wear a mask under any circumstances. And in fact, if you wear it, you'll actually get sick because you'll touch your face. To actually, masks are what you need to do, but don't do it right now because we got to save it for the doctors. To everybody wear a mask. And you really need a voice that helps the public not see this as, God, scientists don't know what they're talking about. They're saying, no, look, this is where we're heading. This is why.
Yeah. I wonder if the cat is out of the bag on this, that in a sense, you were able to do that in the past because academic publishing was very slow. It went through the peer review process. No one really knew where the scientists were. They couldn't just communicate on Twitter or Facebook as they do today. And so it was much easier to control those messages. And you could have two worlds. You could have the world of public health, which were simplistic messages that go out on the mainstream evening news. And then you could have the scientists beavering away, sending faxes to each other in private. With the internet, we've lived with 25, 30 years plus of this happening out in public. And it just seems that our institutional response hasn't kept up. I mean, it's interesting to me that some of the best people that I have relied on during the pandemic are not traditional science communicators. They're not the public health officials, although I do think Dr. Fauci, as a Brit watching the Americans, has an exceptional way of managing himself. It's been experts themselves taking time to send blog posts and write tweets that articulate what's going on. I mean, do you think we could really expect there to be a communicator in chief?
You know, it's an interesting question because, you know, one of the things, so in collaboration with the Internet Archive, we've actually been applying Google's video AI in a secure, non-consumptive research environment to actually watch CNN, MSNBC, Fox, and BBC every day. And one of the things that we find is really, it's really fascinating how news is changing in the pandemic era. You know, CNN, for example, since March 20th, I believe it was, they've actually put up the Johns Hopkins death tracker on screen for 8 hours a day solid every single day since March 20th. So the public, no matter what's on, you know, if it's a coverage of anything on Earth, there's the live death tracker up there. In contrast, MSNBC, Fox News, BBC, but largely running death counts in the text in the bottom of the screen, you know, kind of a brief thing here and there. Although MSNBC has also done its own dashboard here and there, they've each kind of done little periods, but it's interesting because the economic side has been largely absent from that. And it is interesting because you see this transition period from news coverage on television, at least, was strictly health related, to all of a sudden when media unemployment starts rocketing upwards and news outlets are laying people off, all of a sudden then you start seeing the media really focusing on the reopening and what are we going to do about this economy? And but also from a visual narrative, the fact that crowds kind of disappeared on television for a while, and now all of a sudden you're seeing crowds everywhere, bookcases in the background everywhere, buzz cuts. We're really seeing kind of these visual metaphors shift, but also this question of who's talking. So one of the things we do is look every time they're interviewing someone, looking at who the person is because they display that text on the screen. And it's really fascinating when you see the very divergent views that different news outlets are going for. Who are those professionals, those medical professionals they're asking? What are their affiliations? This is a really fascinating question. Who is telling the COVID-19 story to the public?
And what I've noticed is that over the course of the pandemic, as it has started to unfold, mainstream media has started to grab more and more experts and more vox pops. It's doing the thing that mainstream media can do quite well, which is use its reach and its influence to find these people to get them on screen. I think one challenge in all of that is that on television, for all its reach, you're only ever given a couple of minutes. And there's a lot of nuance to unpick and to understand. I've found myself being able to follow the experts directly on Twitter, spend time reading what they have to say, spending a lot of time reading papers, academic papers directly. And also the podcast format, where you give an expert 30 to 40 minutes, allows them to provide some of the criticality that lives in their head when they make their pronouncements. And it just feels that as this pandemic has played out in this information-rich environment with populations that are more well-educated than they've ever been in the past, the traditional mechanisms have not kept up. The institutional response has not kept up. So I do still challenge this idea of the communicator in chief, because I just wonder whether it's possible in a world where I can read what's going on in Hong Kong and Italy and Brazil, China and the US all at the same time.
You know, it's a fascinating question because, you know, we're really, especially in social media, we're really watching the peer review process play out in real time. And, you know, the challenge is the public really, you know, we've kind of gotten used to doing our own research, so to speak. But most people, they lack the background, the scientific knowledge to be able to reason through what they're seeing. If they see some paper say, hey, you know, take this drug and, you know, problem solved. You know, it's interesting because every time you see some new drug or some new therapy come out, you see kind of this rush of panic buying for it. And, you know, it's one of those big challenges of, you know, like, for example, this is for the CDC. You know, the WHO says, say, 3 feet apart. You know, CDC says 6 feet apart. Scientific literature is saying 30 feet apart. The CDC on its own website, on one hand, says you have to socially distance. Businesses can't reopen without social distancing. On another part of their site, they say, look, if you're traveling, which is completely fine, You'll be packed in like sardines, no social distancing, and that's completely fine. And on an airline, there's no risk. Because you're wearing a mask and the air filtration system there completely minimizes that risk. So you see the general public ask, well, gee, if an airline can do that, how come my local business can't install whatever these medical filtration systems are? And then we're all good to go. And the problem is there's no one kind of explaining that contradiction to say, well, here's why your local restaurant can't install an airplane filter and be magically open again. And I think that's the one challenge, is helping the public reason through what they're seeing.
That process, helping them reason through what they're seeing, of course, is education. And it is often a public good. In the US, it's probably been underinvested at a public level. In some parts of Europe, it's more evenly considered. The problem with education is that it's a very, very long, slow process. One doesn't create an educated citizenry overnight. It takes decades, perhaps even generations. So it's curious to think, what do we do in the meantime? What do we do in the interim?
And especially pandemics, because it's this really arcane, knowledge. And it's not just medicine. What's interesting about the pandemic is we have, the virologists, you have the people specialized in the physics of how a droplet or aerosol spreads through space, fluid dynamics. You have all of these different pieces that are all weaving into it. And so it's one of those challenges. We're dealing with these really arcane, nuanced questions too of, how viruses interact with our bodies, ACE receptors, and I think that's a challenge of how do you create, a citizenry that can understand questions like that.
It's going to be quite a long journey. I mean, you'd hope that the internet might enable that. You'd hope that people would walk away from this pandemic and say, these are the things that we need to invest in, either ourselves individually as to be responsible citizens, or as states to say, this would have really helped our pandemic response. But as I've watched the media coverage play out and how fractious it's become in the UK and in the United States, I'm not so optimistic.
That's the thing is, again, and I think part of it is because it's become so politicized, it's really become this partisan thing. So thank you so much. That's the end of time. And thank you for watching Collision from Home.